Do you share those concerns we've just heard from the AMA that the health system may essentially crack under the pressure of reopening at 80%?
There's no doubt that many countries overseas did crack, and many people died for not being able to get intensive care in Europe, in North America, in places that you'd expect high quality care. We're going to be under strain, but we have got a system which has been planned for this kind of activity for over 18 months. We do have a fair bit of extra capacity. We can share out intensive care beds, not just in Western Sydney, but Eastern Sydney and in regional areas like Newcastle. So we have the capacity to cope with a lot more than we're currently coping with. Of course, the system's under strain, but for the moment, I can see us coping, but with quite a bit of stress.
Professor, any viewers who were watching us last hour with the news conference with the Health Minister would have heard that the Minister gave you a pretty big shout out as one of the top experts in your field. So it is great to have you live in the flesh to get to some of the questions that we've seen raised, particularly about children and COVID this week. We have seen this war of words now between the federal government, Paul Kelly even saying that Anastasia Palaszczuk, the Queensland Premier, is misleading Australians about the impact of COVID on children. You're the expert. Tell us, how worried are you about children, younger children in particular, who can't get vaccinated yet? How worried about them are you as the expert who's been looking at this so closely?
Well, I'm not worried at all for the awful outcome that some people think might happen in children. That's catastrophizing. There has been not one child die of COVID in Australia. 1,000 adults and elderly people have died. We know who's at risk. It's people with chronic medical conditions, people in nursing homes. They're the ones that we have to optimise vaccination, not just 80%, but actually get them up to 90%. Children are special. They're precious. I've been a paediatrician for over 30 years. I've done research on vaccination for children for over 30 years. If I thought there was a problem, I'd be on the rooftop shouting. What I can see is that primary school children who are not suitable for vaccination, we don't have one at the moment, primary school children get very mild COVID. If they get symptoms at all, it's a cold. Very few are admitted to hospital. So we don't have a vaccine for them. It hasn't yet been approved in North America, where the studies are still ongoing. They don't get severe COVID, and they don't spread it either. Some people think, oh, children snotty grotty. Well, they don't spread it. You're more likely as a child to catch COVID from an adult than to give it to an adult. So households where COVID occurs, it occurs first in the adults and then less often, but it does occur in crowded households in children too, but they don't get it severely.
The Chief Medical Officer, Paul Kelly, in that news conference I referred to last hour, he was asked, of the 134 or so children who have been admitted to a hospital in these latest outbreaks, how many were admitted for social reasons? Now, Paul Kelly actually said in that news conference that you're probably the best person to ask that question too. Have you been looking at that data as to the current hospitalisations in Australia for children and why they're there?
I work with a lot of fantastic infectious disease specialists and intensive care specialists at Westmead in Western Sydney. And they tell me reliably that at least half the children who've been admitted in recent days and weeks have been because their parents were unwell for social reasons, for their care, but not because they were particularly unwell themselves. So at least half the children. The ones that I worry about and that my colleagues worry about have got a chronic medical problem, cerebral palsy, Down syndrome, chronic heart, chronic lung, kidney, liver. Kids like that who are chronically unwell, their immune system is affected, they really would benefit from the age of 12 and above to have a boost, to have a COVID vaccination now. Well, children between 12 and 15 can wait in line. They're indicated, but not yet. What we have to vaccinate is the at-risk kids, teenagers, adults, elderly, and the spreaders, people between 16 and 39 who might be transmitting through the community. So they're our priorities. They're the people who need to be vaccinated and soon. But healthy teenagers and healthy children under 12 don't need COVID vaccine anytime soon.
Professor, I'm keen to know what you make of the argument that's being prosecuted by some medical professionals that it may actually be better for children to catch COVID and recover to develop that natural immunity rather than be reliant on protection from vaccines, which the studies, as we know, does suggest wanes over months. What's your view on that debate, particularly for that 0 to 12 age group?
I'm in touch with colleagues in the UK on a weekly basis, and they've had a lot of children get natural COVID infection, and they've got good immunity. There's some debate about whether vaccination or disease leads to better immunity. What I do know leads to better immunity is that people who are double vaccinated are protected, and were they to get a breakthrough, a mild infection, they get even better immunity as a consequence. So the best thing is to be double vaccinated. And then if you get a breakthrough infection on top of it, your immunity is even stronger and broader and longer. So I see that as the way forward. I also see that we shouldn't be rushing to booster vaccinations next year until we've made sure all our friends and neighbours in the South Pacific, Papua New Guinea, Indonesia, have got really high rates of vaccination. Because if we're going to get in trouble again from yet another wave, and it'll be the Omega strain instead of the Delta strain, that will be because of mutations and lots of infections overseas, and then they'll get imported. And we could have prevented them by being generous. We can look after ourselves and our neighbours.
It's a very good point. Professor Robert Booy, always appreciate you joining us. Thank you.
Pleasure.